Hey everybody, good morning. It is Thursday, which is April 4th. Very eventful week since I spoke to you guys last. And since I spoke with you last, I promised that today we'd be talking about autism and healthcare. And one of the major things that I've discovered in the last 2.5 years is regarding oxalates. Oxalates. Oxalates are no good for people that have autism, amongst other dietary concerns. Wheat, for sure. Casein, for sure. So any milk products or anything that has wheat in it is no bueno for people with neurological issues. So not just anyone that has autism, but one that would have Alzheimer's, any autoimmune issues as well. And definitely if you have kidney issues, you don't want to be consuming high oxalates. Now, oxalates are deposits that are left in your body. Essentially, they're like kidney stones. However, you can have kidney stones and them not show up on an MRI. You could have calcium deposits coming out of your skin, like what happened to me. For about a year and a half, I had been getting sores all over my body and couldn't figure out what was going on, but a couple of clues led me to the answers. So over the course of my life, I've had calcium deposits in my neck, in my back, essentially everywhere. Recently, I had an injury from work, and I went to a neurologist, and she had fast forwarded the MRI, and I saw what looked like bright little dots on my MRI. You know, they were glowing, and I said, "What?" I go, "What is that?" And she goes, "Oh, you saw that?" I go, "Yeah. Can you rewind that?" And she told me that what was in my brain were calcium deposits. And I said, "Well, what part of the brain is that?" She told me that it was my fourth ventricle. Now, the fourth ventricle is where the cerebral fluid and the spinal fluid mix, and essentially they filter and clean out whatever crap is in your brain. So if that portion of the brain gets coagulated with calcium deposits, it can cause a lot of cognitive impairment, a lot of issues. Definitely. It could be hereditary to start off with, and that would make sense because if I have autism, then my father had autism. I believe that they hid it from the family, hid it from me. My dad was a very arrogant man, and no way in hell would he have had his self diagnosed with autism, or me, or any of his children. So, like I said, I've been tested for autism 3 times. I called my brother about 2 years ago to diagnose my dad, diagnose him, and diagnose myself before my brother ever got tested, before I got tested 3 times. So interesting enough, when I had spoke with my brother, whom I've never really spoken to, he told me that he was going for testing, and he didn't know what the testing was or what it was called, but that it was 4-hour sessions, few in a row. And I was not familiar with the testing modules at that time. But interesting enough, we had appointments, I found out later, for autism testing on the same day, date, and time. Different locations. And actually, my brother got tested first and was diagnosed first to confirm what I had assumed. I just knew that my brother had autism, that I had autism, and my father had autism. So that being said, there are primordial calcium deposits, meaning that they are They are presented at birth, and they're just there. And consuming a high oxalate diet adds to that. There's a really good article that you guys should read. I believe it says, I can't remember the name of the article. I'm going to have to. Oxalates is the new something regarding autism. I can't remember. But like I said, guys, this is a one type deal. I can put it in the header, underline, or in the message because I'm not familiar with how to do all the YouTube stuff yet. However, you can Google oxalates and autism and you should find the article. So what it states in that article is that anyone that has autism, in our body, we hold 6 times more level of oxalates, meaning anti-nutrients, than most people in their body. And this is a bad thing because anti-nutrients, they're, you might as well call it the Antichrist. Because that means it's robbing your body of the proper nutrients that you need for your body to function properly. So I had such a high level of oxalates that every time I would try to be vegetarian or vegan, because oxalates come from vegetables, I was getting sick. I was telling people, I'm feeling like I'm being poisoned. I feel like I'm dying. Like I don't feel good going vegan or vegetarian. And so every time that I would have an injury or start to get sick, I would change my diet to an oxalate diet. And I would feel better for maybe 2 weeks, but then I would get 10 times more as sick. So how I figured it out was the culmination of presenting with sores on my body that hurt, MRIs that showed calcium deposits in my shoulders, in my back, in my neck, the MRI where they're in my brain. So I was thinking, why do I have all these oxalates, all these hard particles in my body? And so I started doing my research about the food that I was eating. And the doctor at the hospital, when I had went to pass kidney stones, he gave me the iodine solution for the MRI, and iodine breaks down oxalates. So it was at that point that I had went to the restroom in the hospital, and I felt like I was having a baby out of my wee-wee hole, which is it's just not fun, people. I don't know if you ever knew anyone who has had past kidney stones. It is not fun. I don't know how I didn't pass out in the bathroom in the hospital, but it was freaking horrible. And I can manage a lot of pain, but I've had my friends tell me that they would prefer childbirth over passing oxalates, kidney stones. And I've never had a baby, but I literally felt like, something much larger was passing out of my hoo-ha. So it was not a fun experience, but when I got back into the room with the doctor, I had explained a couple things to him, and he had mentioned, hey, he goes, I don't see much going on. You're already past the kidney stones, but your kidneys seem okay. But I had depressed kidneys for about almost 6 years, really hardcore for 4 years, to where my left kidney was killing me. All the doctors would tell me, oh, it's sciatica. And then I finally met another doctor who looked at some paperwork, my results of blood tests, and said, what's going on with your kidneys? I'm like, yeah. I'm like, these doctors keep telling me that it's sciatica, and I know the difference. So I asked him if I could show him on his body and on mine that I know what are kidneys, what are my kidneys, what are his kidneys. And so once that was confirmed, I kind of was on the mission to figure out what was going on with my kidneys. So the doctor in the hospital said to me, everything looks good. I don't understand. He goes, what it could be, he goes, what about your diet? And I thought about that really hardcore because my diet had changed. I was feeling so sick with oxalate poisoning that my tummy was distended. I wasn't able to eat. I was not able to pee. My pee was at a trickle. It hurt. It seemed like I was presenting with a urinary infection, but no infection. I had slight trace blood in my urine. My vision was that of looking underwater in a chlorinated pool, or if you're at the pool all day and your eyes are just that blurry. My vision was in and out, headaches, dizziness, nauseous, you name it. I was feeling like my body was shutting down. And then it spread into the right kidney after so many years. So being in excruciating pain, not feeling good. I was only sleeping 7 hours a week max. That's about an hour a day, which is horrible. So I was losing my mind. I was losing my cognitive abilities. I was severely depressed. I was having suicidal ideation, lots of anxiety, and essentially I was dying. And when the doctor said, check your diet, I had a eureka moment. And the day before going to the hospital, my friend had a starfruit tree. And from the starfruit tree, she gave me about 5 or 6 starfruits. And I don't particularly care for starfruits. They're not very tasty to me. But I figured, starfruit has lots of nutrients and vitamins. My stomach was so distended and I was feeling so crappy that I was not able to eat. I had lost, at the time, before I got sick, I weighed 150. At the time of what I'm telling you in the hospital, I was weighing 127, and I lost all the weight within, had to be less than 6 weeks. It was about 5 weeks. So I went from 150 to 127. And I was looking really, really, really sick. So he said to me, check your diet. And I considered this and I thought about those star fruits because that was the only thing that I consumed for 2 days. And I consumed 4 star fruits on an empty stomach. So while I was in the hospital, I kind of shot up from the bed and don't know why, after I did a mini meditation, I decided to Google this exactly. Side effect of star fruits. So now, when I Google side effect of star fruit, I find an article that just has 2 paragraphs. And the main headliner on the article was the toxicity of star fruit. And I've never looked up a side effect of any fruit or vegetable in my life. I don't know what, my higher power, my angels really put that in my heart to Google what is the side effect of star fruit. You wouldn't think to Google what is the side effect of fruits or veggies. And so what I found out was, that's how I learned about oxalates and anti-nutrients. And then everything started making sense to me because for all my life I've had bad teeth, but great, oral hygiene on and off. When I eat a lot of vegetables, my hair will fall out. Like exponentially. Just a lot. A lot of things were happening. I had anemia for most of my life up until my early 40s. Bad teeth, bad hair, osteopenia. I was fighting osteopenia for up until my mid-40s, anemia, really bad. And these are all signs of malnutrition and other things going on. But yes, definitely malnutrition. So if your body's not getting enough nutrients, you're going to have hormone problems, you're going to have teeth problems, hair, nails. So I decided to change my diet to a low oxalate diet. Because when I did my research about the oxalates, I had backed up my research by finding that article about oxalates and autism. And that did show that people who have autism do retain 6 times more the amount of oxalates in their body. And so spinach is one of the highest oxalates. Just a gram of spinach has a whole lot of oxalates in it. And I was eating a bag of spinach a day. And I was drinking almond milk, which is the second highest level of oxalates. So literally I was poisoning myself. I was correct that I was harming myself. So I decided to go on a low oxalate diet. Within, I would say 5 weeks of 6 weeks maybe of having a low oxalate diet, my vision went back 20/20. And previously people were telling me, you need glasses, you need glasses. I go, no, it's something going on with my body because my vision one day is good and then one day it's horrible. And it's progressively gotten worse, but I do have moments of clarity with my vision. My vision, my distended stomach went away. Headaches went away. Dizziness went away. Nauseous went away. Kidney pain subsided. For many, many years, actually my whole life, I can remember since my 20s, I had been describing to doctors that I feel like the left side of my body is sick. Like I feel an even split, and I feel like the left side of my body is sick, and that's the only way that I could describe it to doctors. So when I would go to the doctors, I would tell them this and this and this is going on. I can't see, I'm distended, I can't pee, it's and they can't find anything wrong with me. So they're thinking that I'm a hypochondriac, and they're thinking that I'm exaggerating because they couldn't figure what is going on. Then you add autism to the mix. You get emotional, you get upset, you get dysregulated. Nothing violent or crazy, just, emphatic about wanting to know what is wrong with me. Why do I feel like shit all the time? Why am I sick? So I forgot where I was, but anyway, a lot of improvements going on low oxalate diet, and of course, when you feel better, physically, you feel better mentally. And for years, I was telling doctors, look, I'm a happy person, happy-go-lucky. I make the best of things. I have a positive attitude. I'm not a depressive person originally. Yes, I have issues at times with emotional regulation, but I'm not aggressive or nasty. Most I do is I cry and get emotional, and I'm teary-eyed. For my whole life, I was crying all day, every day, the drop of a hat. Just really everything was really intense for me. I was having a lot of stimming behaviors. I was just feeling like I was losing my mind, losing my shit. And I really thought I was going to die. I looked so sick at 127, 25 pounds. It was not a good situation for me. Especially with my build and my frame, just really wasn't getting enough nutrients, and I hadn't been my whole life. I hadn't been getting enough nutrients and vitamins in my body, been fighting to stay alive, essentially. So that split that I felt within 3 months went away. I feel like I have completeness in my body now, that it actually feels quite unusual at times, because I'm used to, like I said, the best way to describe is that the left side of my body, I felt a perfect split, and it felt like the right side of my body was healthy and the left side was unhealthy. And I was having excruciating kidney pain for 4 years, and the doctors keep telling me it's sciatica, and then I would get upset because the doctors, they don't listen, and they couldn't figure out what's going on. So I did more research regarding oxalates before I went on an oxalate diet. I completely eradicated the oxalate, which is really not a good idea. You should start eliminating things one by one, but I was so tired of being sick, and I was in supreme danger of having renal failure because it was spreading into my right kidney. And so I decided to do it the hardcore way and just omit all oxalates. I would not recommend that. And I wouldn't recommend this diet for just anyone. Definitely, what works for me works for me. You definitely have to consult with your doctor, do your own research. You know your body, advocate for yourself. And it really took a lot for me to advocate for myself, because even when after I figured this out and I was going to doctors with all the scientific information, like I had it in my hand, I had a book and I had snapshots of everything, from the calcium deposits in my brain to the oxalates in my diet and everything else. I mean, I had a folder on my phone and a physical paper folder for the doctors, which they did not want to look out. Okay. And why do not kidney doctors tell kidney patients about oxalates and the consumption of oxalates? So again, if you have a kidney issue, for sure, I would definitely recommend you do your research regarding oxalates, because that's what causes kidney stones. Okay. So there's many different treatments for oxalates. I'm going to only tell you about what I did to treat my situation. So aside from omitting and eradicating immediately all oxalates, which I wouldn't recommend, you should wean yourself off, because it can cause a lot of other complications if you get off of oxalates. Just with anything, if you don't wean yourself off, you risk other complications, which we can get into at another time if you guys are interested. Put something in the message and ask whatever questions, and I'll do my best to answer. So that being said, trying to figure out the oxalate thing and do all the reductions has really, like I said, improved my life. My cognitive ability has come back. I am able to sleep now at least 5 hours a night. Even before that, for my whole life, I've only been able to sleep 3 or 4 hours a night. My vision is back, mostly 20/20. I'm getting older. I do need my reading glasses. I don't have distension in my stomach unless I cheat on my diet. I'm not nauseous or dizzy anymore, and I'm not crying every day. I don't have that. I'm not emotional because I know what's going on with me, and I've been able to take care of it and fix it. And I don't remember where I was before this point of the conversation, because my ADHD is kicking today. But I'm doing my best, guys. So let's just start off with this. Let's investigate oxalates. Let's do our research, more than what I told you. Don't take my word for it. But a lot of improvements have happened since I've been on a low oxalate diet. I feel like a whole human being. I feel mentally, physically, spiritually, and emotionally much, much, much better, because when your body is getting the correct nutrients, of course, you function better. And when your body is not getting the proper nutrients, of course, it could affect you mentally, physically, emotionally, and spiritually, because, I couldn't figure out what was going on. And only to be called a liar and a hypochondriac to find out that essentially my body has an aversion to vegetables. That is crazy. I had never assumed or thought that is possible. But plants have a natural defense mechanism. They have components that are not meant to be eaten. One of those components are anti-nutrients. Just like any other animal or insect in the animal kingdom, they have natural defenses to protect themselves. And just because these things look edible, they are not edible for everybody. Not everybody's system can handle eating just any old vegetable. And I grew up with Popeye. We learned that Popeye, you eat your spinach and you grow strong. And they tell you that eating vegetables and fruits are good for you. And there's a lot of vegetables, there's a lot of fruits that are extremely high in oxalates, and I just wouldn't recommend it. I would, like I said, do your research, find out what works for you. For me, I had to go cold turkey off the oxalates because I was in a bad situation with 2 depressed kidneys. So I felt like I had no other choice. So make sure that you do consult with a doctor, you drink lots of water. If you decide to do it, I promise you, if you do it, you will. My whole life has changed. I feel like a human being. I feel like I have a chance. And as I mentioned earlier, I've always been saying it's not. I am not originally an emotional and 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 difficult person, which is how the doctors made it seem. It's just that I was trying to figure out my health and I was trying to get better, and the doctors gave me no answers. And it's so frustrating going back and forth to the doctors and telling them, something is wrong. But I figured it out. And my whole life has changed. And this is something I really want you guys to explore, because I want you to feel good and feel healthful so that you can proceed, with your goals in life, with what you want to do. Because I didn't feel I really had a life before figuring this out. I felt like I was just caught in a nasty loop of suffering mentally, physically, emotionally, and spiritually. And for years I was saying, it is not the mental affecting the physiological, it is the physiological affecting the mental. And I would just try to advocate for myself and kept repeating that. So I know it's difficult if you have autism to advocate for yourself, because sometimes, when the tears come on, the doctors, they're not listening already. They're treating you like a number. They want you in, they want you out. Doctors is about numbers. Doctors are about prescriptions. That's how they get paid. And it's really hard to find a good doctor. And so I'm grateful to my higher power and whatever my angel entities that led me to figure this out so that I could pass the knowledge to you. So let's just do a quick recap. Oxalates, they're bad. They are so bad. For anyone that has a neurological issue, anyone that has an autoimmune issue, and certainly anyone that has a kidney issue. Oxalates are kidney stones. That's one way that they present. I had them coming out of soft tissue and injured areas, and it really hurts. The sores lasted for more than 18 months, and which is very dangerous because, you can get staph infection, you can get so many complications could happen. And I'm so thankful that I'm still here. I didn't harm myself. And I'm here to pass this information along to you. So do your research, guys. Take care of yourself. Spread the word to your loved ones. Again, anyone that has a neurological issue, autism, Alzheimer's, anyone that has an autoimmune, thyroid issue, or any kidney